Support for this show, Politics Done Right, comes from politicsdoneright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It, As I See It, Class Warfare, The Only Resort to Right-Wing Doom, It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Egberto, Willies. Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is Politics Done Right. Welcome to one more edition of Politics Done Right. I'm Egberto Willies, your host. Listen, folks, he is an American advocate for health insurance payment reform. He is a former health insurance industry executive, a communications director. He is the New York Times bestselling author of Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans. He's a critic of HMOs and the tactics used by health insurers. Wendell Potter is one of our leading national advocates for major reforms of the insurance industry, including a supporter of Medicare for All and universal health care. He is that voice that we need to be listening to right now, especially in these times. Welcome to Politics Done Right, Senor Potter. Well, you said Wendell. Welcome to Politics Done Right. How are you doing today?
Thank you, and please do call me Wendell. It's good to be on the show. Thank you so much.
Well, look, let me tell you, it has gone from bad to worse. I remember during the Affordable Care Act, you had said, watch what's going to happen if we don't get the public option in the Medicare expansion. They will game it again. I just want to start there before we get into the core of what we're going to talk about. Your thoughts?
That's right. I testified before Congress a number of times when members of Congress were debating what became the Affordable Care Act. And I said that if they pass that bill without a very good public option, that they might as well call their bill the Health Insurance Industry Profit Protection and Enhancement Act. The House did pass a version of the bill that had a public option. The Senate did not. And so we wound up without it. And I hate to say I told you so, but since that time, big insurance companies have gotten so much bigger, so much more profitable. They're massively bigger than they were when I was in the industry and at that time, to the point that two of those big insurance companies are now number 5 and number 6 on the Fortune 500 of the biggest American companies. Their profits are outsized, and they are just able to do pretty much what they want to do. They're controlling our healthcare system in ways that I feared, and we've simply got to do something about it. We really need to wake up to what's going on.
Now, you were an insider. You were a part of this whole entire insurance industrial complex, if you will. What within your soul made you say, you know what? I'm going to leave these millions of dollars that my future worth would be, and I'm going to do what's morally right. What got into you that? Because I want to, for the audience, I want to say something that's important, Wendell. The current people in the healthcare industry, in the insurance industry, they are doing their fiduciary responsibility, which is to maximize the profits for their shareholders, enhancing the executive bonuses. They're doing nothing illegal. They're doing what they're supposed to do. You are just a cog in the system.
That's
what
right.
Wendell has said is that's not how a healthcare system should be run. It shouldn't be run in that framework. Run with that, sir.
Well, that's right. When I first started working in healthcare, I was working for a nonprofit hospital system in Tennessee, where I'm from. Then I went from there to work for Humana and then Cigna. So 20 years I spent inside two of the biggest insurance companies in the country. And I, at first, was unaware of the implications of for-profit companies or Wall Street controlling our healthcare system. But I became more and more aware of the consequences as I rose up through the ranks at those companies. I was able to see things that most people do not have a chance to see. I worked very closely with the CEO and the CFO, the investor relations team. I came to just see and understand how Wall Street does control our healthcare system or controls those companies and any other company that is an investor based or owned by investors. I had a crisis of conscience. In my first career, I was a newspaper reporter, and I tried to make sure that I was telling the truth and never obscuring anything that was important for people to know. But I came to realize that's exactly what I was doing in my role. I was vice president of corporate communications for Cigna. I worked, one of my name was on every one of the company's earnings releases for 10 years. So I had to know how these companies made money, where it came from, and what they did with it. And I came to realize that the way they made their profits was, in many cases, making sure that people did not get the care that they needed. And the system that we had in place was one in which increasingly Americans were not able to buy insurance. 50 million people didn't have insurance when I left the industry and when Congress began debating what became the Affordable Care Act. I came from humble beginnings. I grew up in rural East Tennessee in a working class family, farming family. And I know what poverty is like. I know what it is like when people do not have access to care. Some things happened to me a few months before I decided to leave my job that just made it abundantly clear to me that I was doing the wrong thing, that I was contributing to the problems in our healthcare system, and I decided I couldn't do that anymore.
You tell a story about seeing people come down from the hills to get healthcare, to get free healthcare, and the impact it had on you, your psyche. Tell me a little bit about that.
Yeah, while I was still in my job, I flew back to visit family in East Tennessee. And I read in the hometown newspaper about something that I'd never heard of before. An organization called Remote Area Medical was hosting a big outdoor clinic or a clinic at a county fairground not too far from where I grew up. I was curious because the article said people would be coming from hundreds of miles away, even as far away as Ohio and Florida, to get care that was being provided free by doctors and nurses and dentists who were volunteering their time over 3 days. This was in late July, and I went there again out of curiosity, and I saw something that just shook me to my core when I went into the fairground. People were lined up by the hundreds, waiting patiently to get care. It was raining that day, so these people were soaking wet, but they were not going to be leaving their lines because they had been, in many cases, sleeping in their cars for days to get an opportunity to go inside the fairground to get the care that they needed. And I saw that some of those lines led to barns and animal stalls on that fairground site. This was a county fairground. And I just immediately realized that I had to take some responsibility for what I was seeing, because my job was to help perpetuate the system that we had in place, the system that still is in place. And I made a commitment that day that I would have to find some other way to earn a living. I saw people there who could have been people I grew up with, could have been my neighbors, could have been high school friends, could have been relatives of mine. Tears flowed down my face as I was looking at what I was seeing. And I made a commitment to try to figure out what I could do about that. I didn't think I would be a whistleblower. But I just knew that I couldn't keep doing what I was doing, despite the fact that I was making quite a bit of money.
It's interesting because you're a whistleblower, and you've blown the whistle and you blow the whistle over and over again. And it's amazing how the gravity of the system is so self-sustaining. One of the things that I promised to do in my life and with my platform, and hopefully with your help and the help of everybody else, is to just let the average rank and file American understand what you saw there is not an anomaly, but it's something that's out there throughout this country, the richest country in the world, where we can't get the healthcare that not that we deserve, but the healthcare that as a rich country, we have all earned. We have all earned, irrespective of whether you are a McDonald's flipper or an executive in a corporation. Now, it turns out that in the past, one of the reasons Medicare came into be is because private insurance couldn't quite find a way to profit from the healthcare on older people. So therefore, right, as usual, the things that are not that the private sector cannot make a dollar on, they usually pass it on to the government. The government will take care of that. So Medicare was passed on to the government. Now, following that, bribing politicians, these guys figured out a way we can take back Medicare in a more secure, in a more advantageous way for us. Why don't you explain to us that procedure that occurred that has led us now to Medicare Advantage, one of the largest frauds on the American taxpayers?
You're exactly right. Insurance companies had no interest in trying to insure older people, people on fixed incomes, people who didn't have a lot of money. Those people couldn't afford their premiums. So that you're right. That's why the Medicare program was created. But over the past several years now, past 20 years in particular, these companies have figured out, because of their closeness to politicians, they were able to convince politicians that let us take care of access to care for people who are enrolled in Medicare. We can do it more efficiently. We can make sure that people get the care that they need and cost taxpayers less money. That certainly was, they sold policymakers a bill of goods. I, at the time, thought, well, maybe that is something that can be pulled off. So I was going along with it. But what we have seen is that more and more taxpayer dollars are going straight into these big companies. And what they're doing through their Medicare Advantage plans. Medicare Advantage, by the way, was created in 2003 when Congress passed what was referred to or called the Medicare Modernization Act. Mm-hmm. It created not only the version of private Medicare that we have now, but also the Part D prescription drug plan. And both of those programs have turned out to be extraordinarily big cash cows for big insurance companies. And they have been aggressively marketing these plans to the point that more than half of people who are eligible for Medicare in America these days are enrolled in one of these plans. And they're extraordinarily profitable because these companies have been able to rig the system to get more and more money out of the federal government, out of our tax dollars. And one other way that they're able to make so much money is by refusing to pay for care that people need. There's a practice called prior authorization that is used aggressively by these companies to make sure that people are not getting the care that their doctors know they need. So people are dying. People are dying prematurely because of these denials and delays of care in Medicare Advantage.
Now, let me ask the question this way. How do you convince a politician that a government who is administering Medicare, whose sole expense is administering that bill, figuring out how to pay, figuring out if there's fraud here or there, compared to a private company that has to pay high-paid executives, that have to pay bonuses, that has to pay shareholder dividends, that has duplicative services, meaning if there are several insurance companies, each of them have their own database administrators, advertising budgets, all that sort of stuff. All of those are all costs coming out of that same pot that the government would have to spend out of if it didn't. In other words, all those costs are costs not going towards healthcare. It's going towards administering.
Yeah.
Why would they fall for the private sector fallacy that's been told many a times, that in every case, the private sector is more efficient than the public sector?
Really three ways. One is obscuring that kind of information, to hide that, to not talk about that. You don't ever lead with that kind of information. The other is through relationships and ideology. You are able to convince politicians that you have helped fund their campaigns, that are ideologically aligned with your point of view, who have the opinion that the private sector can do anything better than the government more efficiently. And a lot of politicians, a lot of people buy into that. We in this country have this notion that the capitalistic system is sacred and something that can always do a better job of whatever it might be than the federal government. So you have that. But the other thing is what I was alluding to, campaign contributions and lobbying. These companies are able to shell out millions and millions of dollars every election to campaigns, and they send money to both Republicans and Democrats, and that's protection money. And they spend a lot of money on lobbyists. Every big company has a lobbyist on staff, but also spend enormous sums of money hiring firms that do lobbying in Washington and the state capitals. So you have all of those things playing together, and that has got us to where we are now. It's lying and obscuring information. It is lobbying, and it is campaign contributions, and just frankly, ideology. So many people are blind to the fact that these companies are ripping off taxpayers left and right.
Before I came on with you, the first Saturday of every month, I have a program, an addendum to my radio show called Ask Egberto Anything. And I told them today that I was speaking to you, and, they were very happy to know, wow, you're speaking to Wendell. Ask him two specific questions. Since we're talking about Medicare Advantage, they said, what can we do to change the name Medicare Advantage to something more appropriate to let people know Medicare Advantage is neither an advantage nor is it Medicare?
One thing is to support a bill that was introduced by two members of Congress, Congressman Mark Pocan of Wisconsin and Ro Khanna of California. They are the lead sponsors of a bill that would prohibit these companies from even using the name Medicare in their marketing materials. That is really important because people don't know the difference. And the advertising that they do conflates the two programs. People don't know that Medicare Advantage is really a privately operated big business. They don't really understand that, and the advertising purposely obscures that. So that's one thing. One is to support that legislation, to write letters, make phone calls to your members of Congress to support that. And also to support legislation that would crack down on how they're marketing these plans. There are also bills before Congress that would do that. I'm seeing that members of Congress are beginning to wake up, certainly on the Democratic side, but even Republicans are beginning to understand how the program that they largely created has been ripping off taxpayers, has been depleting the Medicare Trust Fund. But it requires people to reach out to their members of Congress and say, this is something that has to change. And the various ways we have to change it is, number one, like you were saying, keep these companies from even using the name Medicare in their marketing materials.
The next question, and this I think is a difficult question. I don't even know where to start, but right now we spend more than twice what probably the most expensive country spends right now on their healthcare. How can we, forgetting about insurance and all of that, how can we reduce the amount that's being spent on healthcare, given that our outcomes are no better than the other countries?
Well, you really do have to have a fundamental overhaul of our healthcare system to do that. The biggest reason is because of administrative costs in this country. About a third of what we spend, and we now spend $4.5 trillion on healthcare altogether, which is, you're exactly right. It's twice as much as the average of all the other developed countries in the world. And those other countries provide better care than we do, and they provide universal coverage, and we don't. And it's largely because, number one, the administrative cost, when you have all these insurance companies and for-profit entities involved in healthcare, every one of those adds to administrative costs. When you have these private insurance companies operating, all of those companies have high administrative overhead, but they make it necessary for doctors and hospitals to also have administrators, people who do nothing more than work day in and day out with big insurance companies. So that's a big thing. And the other is to just curtail the power of these big companies, break them up. You've got, like I said, United Healthcare is the fourth largest company in America. CVS, which owns Aetna, is the sixth largest. Cigna, where I used to work, is the 15th largest. They're far, far bigger than they were when the Affordable Care Act was passed. We've got to work with our members of Congress and the administration, with the FTC, to call for these companies to be broken up, because we're getting to the point that you've got just a very, very few large corporations run by Wall Street and investors that is really calling the shots. And they don't have any incentive in bringing down the cost of care, because as the cost of hospital care goes up, as the cost of drugs go up, these big insurance companies just increase premiums. And that is costing our employers and all of us as employees and taxpayers enormous sums of money that's simply unknown in other countries.
As someone who understands that Medicare for all, healthcare for all, universal healthcare, whatever you want to call it, one word, we are all have healthcare. It's a right that we all have healthcare. I understand that if there's a single payer handling that, I understand that if we take the for-profit method out of the delivery of the service, out of the administrative service, that it would be more efficient. My question to you, given the infrastructure that we have in this unwieldy system, what would be the pathway? What would be the migration from this unwieldy system into a well-organized healthcare for all system?
It's a very good question. And I think there are various ways of getting there. One is to try to get it done in Washington. That's a very, very heavy lift, as we've seen. There are organizations that have been trying to get that to happen for more than 30 years. The other is through the states, and some states are considering legislation, California in particular, but also other states have legislation that will be considered that would create a state-based single-payer system, or some kind of a system that would be similar to other countries around the world, other developed countries that are doing this much better than we are. So that's one way. I think it is going to be very, very hard for us to see that kind of change in Washington until we do something about who is in Congress. You've got the makeup of Congress now such that it's not going to happen in the foreseeable future. So we've got to get involved in the political process. My second book was called Nation on the Take: How Big Money Corrupts Our Democracy and What We Can Do About It. And that is at the core of the problem that we have, is that these companies are being able to control the levers of power in Washington and the state capitals. We've really got to address that. And whenever I have a chance to talk to people who support single-payer healthcare, Medicare for all, whatever you want to call it, or just to progressively improve the system that we have, you're running up against the power of these big corporations that spend so much money, as we were talking earlier. So you've got to do something. I ask advocates, try to devote some time and attention to money in politics, because that is so important, so fundamental, and it's a big barrier to getting to where we need to be.
Wendell, my last question is always the same. What would you have liked me to ask you, or what should I have asked you that I didn't?
I don't know that you've covered fundamentally, I think, the biggest questions, the biggest reasons why we are where we are and what we need to do. I think that I would say that to get to universal coverage, let's not get hung up necessarily on one path. We've got to consider how else can we get there? What other things can happen? And I would say that employers have a big responsibility as well, too, because so many of us get our coverage through the workplace. I would encourage people to talk to their employers, to their HR people, to protest the fact that every year our premiums go up, our out-of-pockets go up. So we've got to wake up and realize that our pockets are being picked day in and day out. I lead a coalition of organizations called Lower Out-of-Pockets Now. There's stuff that has to be done that's incremental before we get to single-payer health care, so that we're not spending so much money and not being able to pick up our medications, not being able to go to the doctor because of the high out-of-pocket costs that we are subjected to. So there's a lot that we can do as advocates other than just supporting Medicare for all or universal health care, whatever you want to call it. We've got problems right now. People are dying every single day because of the practices of these companies. So I would encourage people to pay attention to that and call on their lawmakers to do something about the things that can be fixed right away. Rather than looking down the road to achieving a healthcare system that is more just. There's some steps we can take right now to get us closer to where we need to be.
I'm glad you said that, because that also helps me, because there are certain times that I just want to jump on it and get it done all right away. But you're absolutely right. There are things that we can do incrementally right now that eventually puts us on the path there. Wendell, you have a newsletter that is packed with information. And I tell you what, I am ashamed that I didn't quite read your newsletter before. I just read the material that you put out there in the ethos all of the times. I found that I just want you to know, I became a paid subscriber of your newsletter today. Why don't you tell people how they can find your newsletter?
My newsletter, thank you, Egberto. It's called Healthcare Uncovered, or Wendell Potter's Healthcare Uncovered, on the Substack platform. You can find it at wendellpotter.substack.com, or just Google me and Healthcare Uncovered, and you'll find it. The content is free. I do appreciate the paid subscriptions because that helps us to do more reporting. We have, I think, some of the best analysis and essays on healthcare that anybody's producing, things that other reporters are not covering. And we have some other voices that contribute as well, too. So thank you very much. And I hope people will sign up. Again, it's free, but we certainly appreciate the paid subscriptions. It helps us a great deal.
Wendell Potter, one of the leading national advocates for major healthcare reform in the country and the author of Deadly Spin, an insurance company insider speaks out on how corporate PR is killing healthcare and deceiving Americans, as well as the other book that he just mentioned that will also be in this blog. Thank you so kindly for having been on Politics Done Right.
Thank you so much, Egberto. Thank you.
Manufactured Consent. Manufactured Consent by Joanne Reid. I want you guys to listen to this. Manufactured consent means it's not real. They manufacture that this is what people want. And the people who do it are the wealthy, and they use techniques that are sort of elaborated in the Powell memo. When I saw this piece yesterday by Joanne Reid, I said to myself, Joanne Reid has just joined the team, what I call the Ali Velshi team. Ali Velshi has been able to use the platform that would normally not allow them to say certain things in such a manner that they can do it without any severe repercussions. So I tell you what I want you to do is listen to Joanne Reid about manufactured consent, how the Black church, Black folks are being used in it with Trump to make it seem like if Trump wins, it wouldn't be something that the plutocracy enforced, but supposedly some change in American attitude. And who best to have this change in American attitude than Black folks and other folks who normally would not vote for Donald Trump. Folks that make it impossible for Donald Trump to win. So I want you to listen to this, and then we'll take it on the other side. It is what she did in this work here was nothing short of impressive.
Manufacturing consent, a concept introduced by Edward S. Herman and Noam Chomsky in their 1988 book on the political economy of the mass media. Here's a clip from the 1992 documentary of the same name.
The state loses the bludgeon when you can't control people by force, and when the voice of the people can be heard, you have this problem. It may make people so curious and so arrogant that they don't have the humility to submit to a civil rule, and therefore you have to control what people think.
It is the job of the media, our job, to not just tell you what happened, but to give you some context around what happened in a way that informs you and helps you make decisions in your busy life. But too often, what the media actually does is create a mass consensus around the preferences of the financial and moneyed elite to subtly make their preferences your preferences. This is especially true in selling wars and sometimes elections. The wealthiest Americans have a clear preference for the outcome: Donald Trump reinstalled as president. Mother Jones recently reported the following in an article about America's top donors heavily favoring Trump and the Republicans, which reflects something we've long known about rich conservatives: their disdain for taxation. Mother Jones reports that Donald Trump may have lost in the Manhattan court, where a jury convicted him of all 34 felony charges of falsifying business records. But, quote, one place he and his party appear to be winning in the race to snag major cash from the richest families in America. For all of Trump's supposed grassroots appeal, as of May 1st, less than 1/3 of contributions to his campaign committee for the 2024 election cycle had come from grassroots donors. That means people giving less than $200. According to Open Secrets, large contributors accounted for 69% of Trump's $121 million total, whereas President Biden's campaign committee, which took in $195 million, got 54% from large donors. More broadly, the lion's share of confirmed contributions from the biggest political givers, the top 100 families, have flowed to Republican candidates and groups. Then there's something called hard money. This is the money contributed directly to a specific candidate, and these are donations that the federal government caps. In the hard money category, Mother Jones reports that Republicans took in 27% more from the top 100 families than Democrats did. In dollar terms, that's about $86 million for the Republicans versus about $68 million for the Democrats. But if you include soft money, the unlimited donations that the Supreme Court made possible through their Citizens United ruling during and maybe in response to President Obama getting elected by a 10 million vote margin, it's not even close. Quoting Mother Jones again, Republicans raked in a whopping $508 million from the top 100, triple the Democrats' $169 million take. It's a lot of numbers and data, but it may leave you wondering, why would America's wealthiest families continue pouring money into a political party that has stripped itself of its dignity to fashion itself into a religious cult centered around a 78-year-old 37-count felon and adjudicated sexual abuser? Michael Mechanic of Mother Jones, who authored the piece that I'm quoting from, has a pretty good guess. Biden and the Dems have spooked America's richest with their multiple and largely unsuccessful efforts to close abusive loopholes and raise taxes on corporations and the upper crust. The paper profits on appreciated investments that are currently only taxed when the assets are sold. In the meantime, Trump and the Republicans are fighting to extend their unpopular and ultimately disappointing 2017 tax cuts, a move the Congressional Budget Office calculates will cost the U.S. government $3.5 trillion with a T over 10 years. So what does that have to do with manufacturing consent? No one seems to know who originated the quote, but it's been repeated by everyone from James Baldwin, who said he was quoting Malcolm X, to Dr. King, that the most segregated hour in American life is 11 a.m. on a Sunday. It's just a factual legacy of this nation's history with race and religion that there are predominantly white churches and there are black churches. But what do you think of when you think of a black church? Probably something like this. Now, you may even think of images such as these. But what you probably don't think of is this.
What a nice welcome. Thank you.
That is the reaction to Donald Trump at what nearly every major media outlet reported was his visit to a black church in Detroit, Michigan, one of the 10 blackest cities in America, with a population that's about 78% African American and a poverty rate topping 33%. In other words, it would be hard not to fill a Detroit church with black people. So now I want you to look with your eyes. Just look with your eyes again at this crowd. Is what you're seeing here, what you would write in a headline, is a black church? And yet, here was the headline in the New York Times: Trump, in pitch to black voters in Detroit, cast Biden as anti-black. And the Washington Post: Trump portrays rampant crime in speech at black church in Detroit. In the Associated Press: Trump blasts immigrants for taking jobs as he courts voters at a black church MAGA event in Detroit. The Detroit Free Press even ran a photo series online with the headline: Trump visits Detroit church to woo black voters. What they somehow forgot to show was how overwhelmingly white that crowd was, and also how many empty seats there were in that sanctuary. In fact, if you looked at the carefully selected images in their online story, you would probably guess the crowd inside that sanctuary was overwhelmingly black and pro-Trump, literally cheering for him and chanting his name. And you would be forgiven for believing that this reinforces what seems to be the new hot narrative, that it is Black people, specifically Black men, who are driving Trump back into the White House with their overwhelming and historically growing support. And the actual reality that you can see with your own eyes and know, if you peel back the layers just a little bit, is that Trump spoke to an overwhelmingly white crowd inside a large Detroit church that, yes, does indeed have a Black pastor, but which merely served as a venue. And that the people who participated in the roundtable, like those in the audience at that church, were already Trump supporters, not some new historic Black supporters of Trump. Trump was in Detroit to participate in something called the People's Convention, a weekend-long gathering arranged by Turning Point Action, a conservative grassroots group founded by activist Charlie Kirk. It would have been easy enough to ask some of the attendees at that roundtable if they came to that church from the convention. And while several of these stories note that Trump harped on crime as part of his presentation, doesn't it seem kind of ironic and pretty relevant that the guy saying that just recently got convicted of 34 felony counts in New York? I mean, Trump raised the crime rate in Detroit just by being there. And one of his new friends at that event, Kwame Kilpatrick, Detroit's former mayor, is just 4 years out of prison himself, where he was sentenced to 28 years for his role in a wide-ranging racketeering conspiracy that included fraud, extortion, and tax crimes. Kilpatrick extorted city vendors, rigged bids, and took kickbacks and bribes. He used funds from nonprofit civic organizations to line his pockets and those of his family, steering millions of dollars to himself and his friends as Detroit plunged deeper into poverty. Kilpatrick was released because Trump commuted his sentence in 2020. So of course, now he's endorsed him. It's weird, right? How many of the Black men endorsing Trump are formerly prominent and famous Black men who have criminal records? Not like the criminal records this country has racked up for Black men through things like the war on drugs. Nope. For crimes they committed after they were prominent and or rich. Kind of like Donald Trump. Also on hand as part of Trump's Blacks for Trump coalition, Black Republican Congressman John James, who represents an overwhelmingly white, affluent district in Macomb and Sterling Heights, Michigan, meaning not that district, whose congresswoman is Rashida Tlaib. Also, Detroit native and former Trump HUD Secretary Dr. Ben Carson, who hasn't lived in Detroit since he was a child, and more recently has lived in mansions in places like Virginia and Florida. The ever-present Trump apologist Byron Donalds, whose majority white district is also in Florida, and a claque of local Detroit rappers who, apologies, I confess, I've never heard of. The church where Trump held this town hall is called 180 Church. The pastor, Lorenzo Sewell, is a Detroit native who grew up in an abusive home, with his father going to prison when he was a teenager. His experience with the criminal justice system did not happen when he was already rich and famous. He became a drug dealer and gang member as a troubled kid, the way it tragically happens for so many Americans in communities with high rates of poverty. But he had a conversion experience his senior year in high school in 1999, according to his church bio, and later became a pastor. Here he is, claiming Biden and Obama never visited the hood.
President Trump, I'm so humbled that you would be here. President Obama never came to the hood, so to speak, right? President Joe Biden, he went to the big NAACP dinner, but he never came to the hood. So thank you.
This is the part where I point out that President Obama came to Michigan 15 times as president, including Detroit. Pastor Sewell also claimed it's hard to find a Black barber in Detroit for his Blasian kids, which honestly was weird. And in an interview on Fox after the roundtable, he quoted something you've probably never heard of called the Platinum Plan, a Black wealth plan he claimed Donald Trump created, but which actually was the idea of rapper Ice Cube. So not a Trump plan at all. And I'll add this. It is ironic that Trump is attempting to court Black voters in Detroit just 4 years after lying about Black voters in Detroit and claiming their votes were inherently fraudulent. Michigan was one of the states whose votes Trump, Rudy Giuliani, and their little cabal tried to steal in their insurrection. The Attorney General in Michigan has charged 16 people with felonies for trying to steal the votes of Black Michiganders from Detroit. So in making his pitch, I wonder if Donald reminded his new friends that he doesn't think their votes in a city where he won only about 5% of the votes should have counted the last time. Which brings me back to the question of manufacturing consent. We know based on the actual data, donations, the endorsements, and open statements of billionaires that it is the super rich and also Christian nationalists who want Trump back in power, not poor folks or Black Americans. So why is all this energy being expended to try to pin a potential Trump return on these groups instead of on his real base? Because Trump has a big lie about Black people too. And just like all of his lies, it aims to jeopardize democracy by making you think that he did more for Black people than any president but Abraham Lincoln. We will unpack these lies.
This piece shows great journalism. And what is unseen? Donald Trump making the push towards Black men, poor people, etc., criminals. Notice this started way yonder when he pardoned many Democratic politicians that actually did some pretty bad things. Boyanovich from Illinois, when he did Kilpatrick, all these criminals. Notice he hangs around with a whole lot of criminals. He pardoned them for a reason. Okay, he thinks so little about Black folks. He thinks that gives him cred, as if there's an equation between Black and criminality. Now, but that is only the understory. The understory is then to get sufficient support, not necessarily majority support, but sufficient support from these folks that make it seem like his elevation to the presidency wasn't caused by the ones who really are the ones pushing his presidency. Look, many billionaires, Democratic and Republican alike, are supporting Donald Trump. We had one of the guy from I don't remember the group, Citigroup, or one of these guys, Democrat. It's probably not Citigroup. It's one of the investment banking firms. Went ahead and said, maybe Trump isn't all that bad after all. But what they were saying is they don't like what a second Biden administration would look like, because he will be coming for something like, let me see again. Oh, my God. He may actually come for the wealth tax, where we really tax wealth. You see, you average American citizens, your wealth is being taxed. Every time your house, you don't sell your house and then pay your tax on your house. You pay a wealth tax on your house every single year. But the stockholder, they don't. They only pay a tax on their wealth, which your home is your stock. Their stock, they only pay taxes on that. Oh, again, when they sell it. And by the way, they pay less taxes than you, because they pay an appreciation tax that is taxes less than the going tax base for the average American worker. So manufacturing consent is actually, and our Michael Rudnin gets it right, it requires the complicity of the media. That's why it is great to see people like Joyanne Reid, Ali Velshi, and others who go around the natural direction that our corporate media has, and they find a way to put the message out and still stay on air. And there's going to be, after she did that piece, I can guarantee you that many up there, many in the plutocracy, called up MSNBC and said, you better put some tabs on that girl. Again, I am speculating, but I know how these things work. And just like I know they do that when Ali Velshi puts out certain stories and others put out certain stories. But we got to thank those who use the platform at the time that they have that platform to inform Americans of the fraud that is occurring with the media. Let me tell you some of what I feel. There are a lot of people doing a whole lot of good work, a lot of research going on by independent journalists throughout our country. There are a lot of students writing and doing a lot of research papers, etc. But if you read the New York Times or the Washington Post or any one of the major newspapers, the Houston Chronicle, there are select numbers of articles that you're going to read, that you're going to have to. All those articles go through the producer network within that particular company, New York Times or whatever. And each of those companies have two things that are important. Their first of all, their bottom line, and then their ideology. If you take a look at a paper like the Houston Chronicle, you won't see very liberal stories or stories that would have a liberal bent. If you take a look at the New York Times, I know a lot of conservatives like to consider the New York Times the progressive paper of record. It's far from that. At best, most of us most of us progressives consider the New York Times a center-right paper. In other words, it's always towing the line. And to put it bluntly, it tows a very neoliberal style mindset. So therefore, there are a lot of other rags around. I mean, we have the Nations magazine, Mother Jones, we have Daily Kos, you have the independent blogs that I write. You have a lot of people doing a lot of research and good work out there. Why is that important? Because stories that many haven't heard of, many don't understand, many don't see, these get covered. One of the things that I do at this program is many times amplify other stories from rags most people never heard of, don't read, but that are reputable with the information that they have and has a whole lot of backing in said information. And this particular article tickled my fancy yesterday from Mother Jones, and it had a well-researched article. It's a very long article, and the person who wrote the article, it's clear they put a lot of effort into getting their data and getting all this information. Why do I preface it that way? Because one of the reasons we want folks to see these things is that in our healthcare system, whenever we try to make major changes, it is hard. And why is that hard? Because at any given time, most people are relatively healthy. So they are not in contact with the healthcare system on an hourly basis, on a daily basis, etc. So you go through the pain of being with the system for a few hours, if you're lucky, a month or a year. But otherwise, it's just a thing. So you don't get a chance to see those people who have to be chronic users of the healthcare system because of their condition. But the one thing that we know is that at some time, most people at some part of their lives will have some sign of chronic use of the system. And when you get there and it's not there in the right form, it can be devastating. I have a wife with lupus, a wife who just got shingles, a daughter that's had 2 strokes. I stay away from the hospital system, maybe stupidly, but I do, because from the healthcare system, because I have some prejudices against how the system treats people like me. Now, that said, this article about dialysis really was difficult to read. And why is that? Because we have a system that, for the most vulnerable people, it can be very unfair and it can be very inhumane. And the story that Jack started about was Tommy's story. And Tommy was somebody that went in, goes to dialysis treatments 3 times a week. But the one thing he is somebody who wanted to make sure that the people who are giving him this dialysis were doing a good job. And because he complained, he was referred to or called belligerent. And under the law, they were able to deny him care. So ultimately, what happened to Tommy in this system is that Tommy had to wait till he's near death each time from not having dialysis for days, go to the emergency room to get cleaned out, and the cycle begins again. But none of the dialysis companies, and there are 2 major dialysis companies, DaVita and a German company of which I can't recall the name right now. They own 80% of the market. It's been corporatized, the entire dialysis system. Backstory. In the past, when dialysis just came out, there were few dialysis machines in the 60s, but there was a committee called the God Committee. And the God Committee selected the people around the United States who would be lucky enough to use the limited resources of dialysis machines. As time went on, supply caught up with demand, but it was still an expensive proposition, about $150,000 $1,000 a year to be on dialysis. And by the way, all of this occurs because of patents and the commercialization of machines, all of that. I mean, the dialysis doesn't really cost $150,000 a year for a patient. But that's what is charged. That's what a capitalist system does to healthcare. But we'll tackle that a little bit further down. So the God Committee selected who got dialysis back in the 60s when it was invented. And after the 60s, when it was invented, we got the United States government in 1972 said, well, you know what? We are going to make kidneys a special case, and Medicare covers kidney dialysis. And then all these private companies sprung up to give dialysis machines. You know, your nephrologist had a dialysis machine. Little companies had dialysis machines, and they were all able to, make a little profit on giving dialysis. The government was paying for it. Socialized medicine with the assistance of the private sector delivering the care, which meant somebody who owns that dialysis company or that little doctor's shop made a few dollars. Not extraordinarily so. Look, I wouldn't have had that layer at all, but hey, we had that and that worked for a while. But then the government opened it up that said private investment companies and all of that could buy up and be a part of the game. And when they became a part of the game, they started buying up all these little dialysis shop around the country, your private doctor's dialysis center, your small company dialysis center, and they bought it all up, and now they own 80% of the market, two companies. What that means, of course, is that we have a great welfare system for these companies. They provide a service at officially no risk. If you have a sure payer in the government, right? What does that mean? That means you don't have any risk. But the idea behind big profits, if you follow the capitalist model, is that the reason you allow companies to have big profits is because it purportedly creates innovation with those profits. But again, if you don't have the risk, there are two things that happen when you don't have this risk. There's no real need for further innovation. Things are currently working fine. So what do you do next? The next thing you do is you say, all right, since we believe in it, since this system says we want exponential growth. What exponential growth look like is the people who invest in these dialysis companies now, they may expect a 7% return every year. In other words, they want 7% growth, not return, growth. They want 7% growth every year. That's exponential growth. It's something that is not sustainable. So how do they do it? When you had these big companies buy up all these dialysis centers, now two companies own it. Again, the default state of capitalism is monopoly. They would try to tell you no. Government intervention stops monopoly when it prevents monopoly. So the default state of capitalism is to create monopolies. But how do you stop the monopolies? You create government intervention that mitigates capitalism to stop that behavior. That's not what has happened in dialysis. These companies control 80% of the market. And in doing so, the next growth state that they have is how, now that we own the entire damn market, how can we even make more money? And the way they do it is they say, okay, we used to have professional nurses like they have in Canada or Australia or these other countries. We used to have professional nurses that did the work. Well, professional nurses cost too much damn money. So now they have specialized technicians that's trained to do just that job. And for the most part, that works, right? Of course, until some patient has behaviors, etc., that only a professional healthcare provider can understand away from what they have to do in dialysis. So that's what they do to reduce their costs and to have more people, and to have more profits for the investors in these new companies that now control your dialysis. And when that doesn't work, they start using cheaper material. So what a lot of patients were noticing is they were using cheaper bandages that cause rashes on people, that hurt people, etc. And according to the law, a dialysis center can bar somebody from taking dialysis if they become a problem patient. The CMS, Center for Health, I don't remember what it stands for, allows them to go ahead and deny service to these people. And they ask them, if you're going to deny service to this patient, try to find them another place. But if you can't find them another place, no big deal. The patient just have to see what the patient can do. Wait till they get sick enough to go to the dialysis, to the emergency room, which is what happened to Mr. Tommy. So these patients are starting to complain that their bandages don't work right. The nurses don't know what they're doing. They're not really nurses anymore. So the service declines and they start to push people through like cattle. If you go to a Davida Center, according to the article, and I see them all around Houston, and I imagine you see them all over the country. You go to one of these places, you're like a cattle, just giving people through. They have to get you into the machine, sanitize the machine, go back into circulation and do it. And a lot of it wasn't doing right. And if you go ahead and complain about your bandage, if you complain about your service, they start to put inside of your record that you are a problem client, a problem patient. And that record follows you. And so what they're doing is they're building the case that this person is going to complain about our service. Let's build a case so that when we cut the plug, we can have a case that says this person has been a problem client for a long time, a problem patient for a long time. That is what our system devolves to, a healthcare system that is based on profit and not humanity. I'm going to talk about the profit in a little bit. So what we find is in a country right now, over 5,000 people at this time, right now, have been told that they cannot use these services anymore. And these are people that ultimately wait till they get very sick, go to an emergency room, their blood gets taken. Oh my God, you're in renal failure. We got to give you dialysis right now. And then you wait till you get sick again and you get dialysis again and again in the emergency room at a higher cost that we all pay. All of this because these companies that control the system want exponential growth, not only exponential growth, but they want the ability to go ahead, do as they please to make for their shareholder. Support for this show, Politics Done Right, comes from politicsdoneright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It, As I See It, Class Warfare, The Only Resort to Right-Wing Doom, It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Egberto Willies.